Hello, my name is Paul Auwaerter. I'm the clinical director for the Division of Infectious Diseases, and I want to welcome you virtually to your tour and information session for our division. Choosing a fellowship program, I think, is always exciting, and I think it's my job to try to give you, in brief detail, some introductions to the richness of our clinical services that the division would offer to provide you with really a first-rate and outstanding foundation in infectious diseases. And I think this is in no small part to both the kinds of people that we have hospitalized at our facilities here in Baltimore, as well as our outstanding infectious diseases attendings in many of the areas. So, our main hospital is over 900 beds, and we not only take care of patients from the East Baltimore community, which has been historically an African American community with issues also with a Latin American population nearby who have the kinds of challenges and barriers to care and issues regarding social determinants of health that I think many of us are paying more attention than ever in an effort to try to improve health and get people doing better, both for acute infectious diseases and chronic infectious diseases. But we also in this hospital have people from a broad area regionally, from Virginia to Pennsylvania, and then as well as nationally and even internationally. So I think there's many opportunities here to see both the fascinomas and the oddball diagnoses that you might only see very rarely to very common situations that arise in post-surgical infections, diagnostic dilemmas such as fevers of unknown origin. And our services are split with a general infectious diseases service. We also have a service dedicated to patients with organ transplants, hematological malignancies, and bone marrow transplants, as well as a dedicated HIV inpatient service. And then, of course, the outpatient services, which will give you an idea of the kinds of problems that people present in the outpatient arena, as well as in your second year, a longitudinal HIV clinic, which is, of course, one of the requirements for fellowship. I think what's very true when I was making decisions 35 years ago, I was trained in New York City, and I very much wanted to be in a environment where there was many different kinds of problems related to infectious diseases, as well as a well-trained and excellent set of teachers. I think this is more true than ever as our faculty has grown to over 70. We have some amazing and outstanding attendings that help not only in terms of teaching when people are on service and on rounds, but also with some of our key clinical conferences, which include HIV, a management conference where we have many attendings and fellows along with other trainees all meet over a lunch to discuss difficult cases, and also our infectious diseases grand round. So there is no doubt, I think, when you leave our training that you will feel very well grounded in the field of infectious diseases. And I think that's so important because no one wants to become an ID clinician, even though our program is very much geared towards research. I think that solid foundation is very important. So I think you can certainly be assured that that would be the case. And also lots of opportunities if you enjoy teaching, which we hope you do, for also interacting with medical residents and also medical students and trying to help develop your own teaching approaches even more for the fascinating field, which really is ever growing and is just one of the reasons I really love it, that the newness of it is really consistent. So I think without a doubt, you've heard a bit also from Mark Silkowski at Bayview Hospital, our more community-based hospital, which has a bit more of a slant towards what I would call bread and butter infectious diseases. I think you can really rest assured that I am dedicated with so many of our faculty making sure that you have an outstanding clinical experience. And I hope you really give that some thought as you're deciding which programs, and you can really be absolutely confident of coming to Baltimore, enjoying the city in all of its many different facets as a small to medium sized city that really uh, gives both some cohesiveness and opportunities to really get to know it, and also enhance your educational experiences. So thanks very much for thinking about Johns Hopkins as a program, and I hope both the clinical and the research aspects seem to be a good fit, and I think would certainly be the kind of program that would give your career the kind of basis to be successful moving ahead. So thanks so much for listening. I hope you enjoy your day.